Hello, welcome to The Accident. This is a video series about how Americans deal with motor vehicle accidents. And in today's series, we're going to be talking about case management and how it plays into the recovery of a motor vehicle accident survivor. And let me tell you a little bit about case management before we get going. And this way you'll have some sense of what my guests do for a living. Case management is a process and technique to manage the care of specific health care needs. There are often multiple problems, in a way that is designed to achieve the optimum patient outcome in the most cost-effective manner. And what case managers are usually nurses, doctors, or social workers, psychologists, whatever, who work with patients, providers, and insurers to coordinate all the services deemed necessary to provide the patient with a plan of medically necessary and appropriate health care. And some people say it's the closest we have to evidence-based medicine in the United States right now. So I'd like to introduce my guests, who are all case managers, and I'll start to my right here with Carrie Miller. Carrie is a case manager and works as an internal case manager, and which is different than my other two guests. Cheryl Crump, who is also a case manager, and she is involved on an external side, usually working with people outside of programs. And then Mary Donnelly. Mary Donnelly is also a case manager. So I'd like to start by thanking them for joining me, and also by asking some specific questions, which I think everybody will appreciate once we're done with them. And the first question is, what are the biggest challenges that case managers like yourself see with motor vehicle accident survivors after they have an automobile accident? So I'll start with Carrie. How would you like to answer that question?
I think one of the biggest challenges that people have after facing an automobile accident is learning to navigate the system and learning all of the new things between insurance and specialists and therapies and everything that's affected after an automobile accident.
Okay. And Cheryl, maybe I could ask you to add to that. Again, I'll ask the question, what are the biggest challenges you see motor vehicle accident survivors having to deal with after an accident?
I think it's the day-to-day paperwork, how to take care of your employer, how to fill out the paperwork, how to pay your hospital and doctor bills, how to navigate through the system. Okay.
And Mary, I'll ask you to give us your best shot at that question.
Well, I think part of it is educating the family along with what is going on with the patient as far as their treatments, and helping them understand that this patient or their loved one is not probably going to be as they were prior to the injury.
Okay. Now, I think that from my experience of working with motor vehicle accident survivors is many of them have no idea what the challenge might be. And in fact, I think I see many people who need case management and don't get it. And it's unfortunate. And I know at least in Michigan, a patient can request for case management. It can be provided. And in many cases, I think most people aren't aware of that. And I just want to ask maybe all of you to let me know or let the audience know, if they needed to contact a case manager, what's the mechanism for doing that?
They can do everything from talking with friends who've been through something like that. They can talk with their insurance company directly and request a case management assignment. They can look in the yellow pages or online.
Okay. So there's a number of ways that they can find a case manager.
Sure.
All right. That's good to know. Let's move on to the second question here. And this has to do with advantages of using case management after a motor vehicle accident for both the patient and the medical provider, but in many cases the family and the third-party payer also. So we'll start with Carrie again. Carrie, what are the advantages for the person who's been in an accident to use a case manager in dealing with these different people?
I think one of the main advantages is just having somebody in your corner to be able to advocate for you and coordinate among all the involved parties. A case manager can coordinate with your family doctor, with all the specialists and insurance to make sure that you're receiving the proper care without you feeling the burden of figuring it out all on your own.
Okay. And Cheryl, what would you think goes along with that answer?
I think that our biggest thing, besides being a patient advocate, which is always number one, is communicating between the disciplines to the physician, to the therapist, to the insurance company, and making sure that we're all on the same page and working for the same goal.
Okay. Mary, what would you add?
I would say, and it goes back to educating again, letting the family know what is available to them. Because often there are insurance adjusters that do not want to tell the family of the injured victim what really is available to them. And it comes under the law of what is reasonable and necessary. And a lot of times, insurance companies do not want to tell families that.
Okay. And I'm guessing that the reason they do so is they're trying to cut expenses.
Correct.
I'm just cutting to the chase here. Insurance adjusters, their job is to adjust and to keep the cost down. Mm-hmm. Okay.
Correct.
So case managers deal with these different people. And maybe I can break that down a second. You know, medical providers, there's so many specialists now that exist. Over the years, and I've been in healthcare for going on 40 years now, over the years we've gone from almost no specialist to a specialist for everything. And for many of these patients, they need to see specialists and they need to get specialty care and so forth. Is that something that case managers can really be helpful with? How about we start with Mary this time?
I think that's where we really start to work on medical treatment. What happens so often is a person might have other fractures, things along with the head injury. The fractures get healed, and the doctor discharges him, but he's still in need of some help. So that's where I work with a lot of physical medicine rehabilitation doctors. And they are the ones that can work with all of the issues surrounding the person and the type of injuries they've had.
Okay. And Cheryl, what about with the family? Many times I think the family is unprepared, right, for something like this. What's your thoughts about how you interface with the family issues?
I think the family is always unprepared. I have a brother who's a traumatic brain injury when he was 16 years old. So I can firsthand tell you that the family is never prepared for something like that. And it takes quite some time before you figure out that the person who went into the hospital is not always the same person who came out of the hospital. And knowing that their needs are extremely long. And you just have to be ready for that and learn to cope with that piece by piece.
Okay. Carrie, if I could ask you, because I think you do a lot of internal case management, so you're probably working with the patient very often. What kinds of things does a patient need to learn from the case manager in order to have a successful recovery?
I think one of the primary things I can do is provide some education at a very basic level even to help them understand what components there are to treatment and what helps with what, because I think that can be very confusing and even overwhelming for both the client, the family, and everybody involved. So it's a learning process.
Okay. And I think you brought out something that I thought of just as you answered that question, and it's non-compliance to treatment, which is a very big issue in healthcare today. People don't want to follow doctors' recommendations, and they don't want to go to physical therapy, they don't want to take the medicine, all of those things. Is that something that all of you as case managers have to deal with? And maybe you can tell me what you think is a way to get around that. We'll start with Cheryl. What do you think?
Oh, I think it is a problem, and especially following a traumatic brain injury. Not everyone is on the same level of understanding. So you do have to take your time and communicate with all the physicians, the family, the patient, and make sure, again, that we're all following the same goals and what our end result wants to be.
Okay. Carrie, you want to add anything to that?
I think just adding more education. Just because you provide education once, just because you give them tips one time, doesn't mean that that's going to provide the insight that they need to participate in their recovery process. So I think being patient and willing to be there consistently and not just a one-time thing, I guess.
Okay. And Mary, I know that from working with you that you've had some very tough patients over the years. What is it that a case manager can do with somebody who's really non-compliant and is really hurting themselves in the process?
Well, I like to review with them that the insurance company is paying for them to go to all these treatments, and it's to make them better. And it's not just better for today, but for a lifetime. In head injuries, all the cognitive therapies, everything is so that they can function in society as normal as they're able to do. But often they start feeling better and they think they're back to normal until someone's evaluating them and they find out that things aren't really going as well as they are. And family and employers, they all look at the head injury patient and they look normal. And I always say, well, give them 3 things to do and come back in 30 minutes and find out if they've even managed to remember the first one. So it's a constant, I hate to use the word hand-holding, but it is. And it's encourage them that this is to make them better. And if they fail to continue with all these treatments, that the insurance company may not pay for it any longer.
Yeah.
And we don't want that to happen. You know, that I feel we all fail if we do not, you know, help them along through the system.
Yeah, and I want to add 2 things to that. When a person drops out of a treatment stream and the insurance company stops payment, it's not like snapping your fingers to get it to happen again. You usually have to get a lawyer and you have to go through a very long process to initiate treatment again. Could be 6 months. So the person may be out of treatment for a long time. And you know, one of the things I want to interject here is that case managers typically get called in on the more difficult cases, cases where there's going to be complications. And so typically a case management startup is from a place where somebody has special needs already. Okay, let me move on to the third question, and we've been talking about this already to some degree, and it's partly because in motor vehicle accidents, the forced trauma that takes place usually ends up with some traumatic brain injury. It doesn't always get picked up. In fact, most of the time, we're probably under-diagnosing this, but think about a 60-mile-an-hour crash. That force is going through the body, and it goes through the brain as well as through other parts of it. So how are traumatic brain injury patients more of a challenge than other injured motor vehicle accident survivors? And I will start in the middle with Cheryl this time so that we'll give her a chance to talk first. Go ahead.
All right. I can tell you a little bit about my brother. A lot of people will look at Jimmy and think Jimmy's okay. They don't realize that he can't remember what you just told him. They also don't realize that he may have resultant vision problems or hearing problems from the brain injury. There's a lot more with the brain injury that is not visible. So you really have to look far beyond what you see and look towards those other disciplines to help you define exactly what the problems are.
Okay. Carrie, what would you like to add? How are TBI patients more of a challenge than other motor vehicle accident survivors?
I definitely agree with what Cheryl had to say about somebody can look just like they did pre-accident, and then post-accident, friends, family, everybody's wondering why they aren't the same person. But there's so many elements that people are unaware of. They're just uneducated. There's the cognitive fatigue that makes people so unprepared to go through a single day. Getting out of bed and making breakfast can be so challenging when they used to work a 40-hour week. I think that's one really big thing that is very difficult for people to understand.
Okay. Mary, can you add anything to that?
Well, the other thing is I think it's called long-term. And when we talk long-term, we don't mean 12 months, 24. You know, sometimes it can go 4 or 5 years, and then they're doing okay, and then 3 years later they pop up, and there's some things that are occurring with them that we maybe have to back up a little bit, get some evaluations, and move on. So really, when a person has a brain injury, it's basically till death we do part, because that's really, and with Michigan's auto law, the medical is forever, which is good, because if these people aren't helped and auto isn't covering them and we have health care issues in this country, they will end up either having no insurance or on our Medicaid system. And that's what we don't want to happen either. So that is a point I'd like to put home with everybody, including insurance companies, that you can't just close a file.
Yeah, and I want to point out that in Michigan, where all these case management people work, the health care benefits are probably the best in the country. Michigan's motor vehicle accident insurance policy is the best in the country, and provides, as Mary had pointed out, lifetime benefits for people. And I think that we have just, at least through research, discovered that the long-term effects of these things are much longer than a couple months or a couple of years. And I think Carrie had pointed that out, and Cheryl also, that you can look at some of these people and you might think they look normal, but they're not. You know, I've got patients, for instance, who can't taste anymore. And so all the food tastes like cardboard or something like that. And they look normal, but their life has changed because that isn't there anymore. Or I have people who, as you had pointed out, have memory problems, and they constantly screw up things. They're not there when they shouldn't be, etc. There's all this kind of stuff that's going on, and you see that too. And I imagine that that's a big challenge for case managers, setting appointments with doctors and getting these people routed through. What are your thoughts about that?
It is difficult. I have patients that we go ahead and we set up the doctor's appointments, we get everything ready, and the patient doesn't show up. And you have to, through your case management and the other disciplines, teach them how to cancel an appointment and how to contact everybody and let them know the steps they need to take. And it's education and re-education and re-education, and it is a lifetime process.
Yeah. Now, Carrie had mentioned something about cognitive fatigue. And I think that's a very important one to focus on. And I see this all the time. I see people that worked full-time, had maybe a second job, were raising a family, and now they can't make 2 appointments a week to see a doctor and a physical therapist. You know, and they're always tired, and they can't sleep very well, and they have all these other issues. Carrie, with cognitive fatigue, what are some of the things that you can see that can change as a result of therapy?
I think with therapy and learning to utilize tools that are there to help them remember things, help them maintain their life throughout each day, I think that people can see major changes. And they're not going to happen overnight, but I think in time that they can adjust to the new life that they have and be contributing to society, be contributing to their families, and feel like they're worth something again. And I think that's very important.
Okay. Let me move to what is probably going to be our final question, and then we'll have some discussion possibly. What is the most frequent problem that patients experience without a case manager? And why don't we start with Mary down on the end there, and then we'll work back to Carrie. How's that?
When they don't have case management, they do not know where to go to get help. A lot of times they end up with their family physician, who does the best they can, but they do not get referred to the physicians that these patients really need to go to. There is no continuity of care. They're going here for a little bit and there. And with case management, we bring it all together and make sure they're at the right places for the treatment.
Yeah, and nothing to knock primary care physicians, but
No.
you know, the fact is that a primary care physician sees 30 patients a day for about 5 minutes and really doesn't have maybe the time to really do the extensive follow-up. And that's where you people come in and other people, specialty physicians or whatever, who are set up to do that more extensive work. Okay, Cheryl, what do you think?
I believe with traumatic brain injury patients, a lot of times if they're not managed through the system by a case manager, they end up alone, alienated from their families. basically on the street without any medical follow-up at all.
Okay. Carrie?
I agree with Cheryl. I think they become so hopeless and alone because it's so difficult and challenging to navigate the system, and without that extra support, they may just give up and not receive the therapies that they need and will help them recover.
Yeah. Now, if we can kind of round this all up a little bit, one of the thoughts that I had when we were talking was that this puts an extreme strain on the family, and I think that sometimes it leads to families falling apart, disintegrating, fracturing, whatever. You must run into that. How does that get into your routine, or how do you deal with those things?
I think a lot of it is patient education, which needs to include the family as well as the physicians, the disciplines. Everybody, again, needs to go towards the same goal. But we also need to connect the families with support groups so that they get a better understanding of what they're working with. Because they look at their loved one and want to see something that may not be there anymore. You may have a different mother, father, sister, brother than you started out with. And you have to learn how to best work with this person and how to help them reach their full potential.
Okay. And what about employers when they get brought into it? We haven't made much mention about that, but what's some of the effects that happen with an injury with relationship to their occupation or work?
I think that sometimes employers are willing to work with someone who has an injury, whether it's a head injury or a physical injury. Some employers have the capability to do that, and some don't. So we kind of facilitate that in the meantime. We can also work on vocational re-education, functional capacity evaluations to see what the capabilities are, and help facilitate them to return to work if that's a possibility.
Okay. Let me offer a few minutes here for you to just give me your general impression about motor vehicle accident survivors today, and maybe some of the things that you think people should know about. And we'll start with you, Carrie.
I think with the motor vehicle accident survivors today, they're very lucky to have the system that we do here in Michigan. And I would encourage everybody to take full advantage of the therapies and doctors and specialists that exist to help them, because there is hope and there are many things that can be done to help you recover.
And so maybe one of the things that they need to realize is that unless they talk with people like yourself who are guides, they're likely to underutilize the resources they have.
Absolutely.
Okay. And that's an important thing to keep in mind. Okay. How about...
I think that one thing that they need to do, is that they do need to ask for a case manager, whether or not they feel like they're going to have a long-term issue. And one thing we didn't mention is that case management can also help facilitate the legal issues that they may face because of their motor vehicle accident.
Okay. And in many cases, if it's going to be a long-term case, there's going to be legal issues.
Yes.
Okay. All right. Mary, what kind of thoughts do you have for this?
Well, if someone needs a case manager and they call the adjuster, and the adjuster may say, well, we don't think you need one. At that point, I would go back to whoever the treating physician is, and usually physical medicine and rehab physicians are very, very good about assisting a patient with getting a case manager. So I would suggest they go that route. Again, adjusters want to save money, but in the overall, the patient isn't getting what they need. So I just encourage them, go right through their physician.
Okay. Yeah, and I think that you bring up something very important. People are trying to cost estimate what's best for the patient, and they don't want to have the person get services that maybe aren't appropriate. So actually using a case manager probably would save money in the long run.
Absolutely.
Because the case manager is going to have a better idea of what's probably going to work best for many of these people as they go through the rehab process. And I imagine that all of you have, over time, learned that there are certain doctors or certain hospitals or certain physical therapy centers or whatever that are good for particular kind of patients, right? So you have kind of an insider's view of who's best for taking care of this problem or that problem. And so that's important for people who are needing a guide, right?
Right, it depends on what kind of injury they have, what specialty you want to steer them to, or what group you want to steer them to based on their specialty. I think it's also important, one thing we didn't mention is for the patient and family to understand that even though your case manager is paid for by the insurance company, they work for you. Just as your doctor is paid by the insurance company but works for you.
Okay. Well, I appreciate Carrie joining us and Cheryl and also Mary and being able to share about case management. And again, this is one in the series of videos about surviving motor vehicle accidents. And we appreciate the fact that they were able to join us, share their expertise, and we hope that you've gained something from being able to watch this program. Thank you again. I'm Ziggy Kozicki, and keep in mind we have others in this series that you may find to your benefit. Thank you.